The coronavirus newscast is here in an hour. First, and later than billed, question time with Fiona Bruce.
Welcome to Question Time. On tonight's panel, the government's social care minister and former deputy chair of the Conservative Party, Helen Whately. Labour's newly appointed Shadow Secretary of State for Scotland, currently Labour's only MP in Scotland, Ian Murray. John Swinney, Deputy First Minister and Education Secretary for the SNP government at Holyrood. He joins us from Perthshire. Layla McCay, a trained psychiatrist who now specialises in public health. She's worked for the World Health Organisation and the World Bank, currently Director of International Relations at the NHS Confederation. And down the line from Edinburgh, Scotland editor of the right-leaning Spectator magazine and columnist for the Scottish edition of the Times Alex Massie. Good evening. Welcome to my guest here, of course, to my guest down the line. And, of course, I'm delighted to say we have a live audience on the programme tonight throughout. It's almost going to be like old times. Not quite, but we've got you virtually, and you're all in Glasgow. So welcome to all of you. I'm so pleased that you can join us this evening. And, of course, for everyone watching at home, you can join in the conversation on social media at BBC Question Time in the usual way and put your points across that way. So let's start with our first question tonight, which is from Alison Goldie.
Good evening, Fiona. Good evening, panel. So, given the success of track and trace will rely significantly on the public's trust in the government and compliance with the rules, does the panel feel this has been undermined in any way by the events of this last week?
Gosh, it feels like we've done nothing else but talk about the events of the last week and, of course, Dominic Cummings. Ian Murray.
Well, thank you for the question, Alison, because I think it gets the nub of how we get out of this epidemic, and that the way we get out of that is to test, track and trace and then isolate, and that's the only way in advance of a vaccine that we're going to be able to go forward. And I think in the last week, with the saga that we've had with the Prime Minister, government, his integrity is in tatters, and we've seen that it's one rule for the Prime Minister and his team and one rule for the public. And we absolutely need every single member of the public to be absolutely in touch with these rules and abiding by them. Otherwise, we will never get to the end of this pandemic. And the word trust, I think it should be called track, trace, test, isolate and trust. And the Scottish Government's also got a big question to answer here in terms of trust, because if you go back to the very start of this pandemic, the ground zero pandemic in Edinburgh was at a Nike conference in a city centre hotel, and the public weren't told about that. Now, the reason that's such a difficult story for the Scottish Government is twofold. One, you need the public to be involved in this, so that they can be used to help track and trace the people that potentially have been infected. So you need them to have trust in that system. And secondly, you need that trust from the public so you can use them to isolate, and you can also use them to make their own choices about whether or not they see family members. So trust is the nub of how a track and trace system works.
But given how critical you are of Dominic Cummings, saying it's one rule for him and one rule for everybody else, why didn't Labour ask for him to go?
Well, Keir Starmer said very clearly if he was Prime Minister, he would have sacked him. And
yes,
the
but
Prime
he
Minister
didn't join the other parties in asking him to go.
Well, I think when the Conservatives are tearing themselves apart over this kinds of issue, there's now over 60 Conservative MPs who've publicly said that he should go. There's over 70 that have emailed back their constituents, of which we've all had thousands of emails about this. The public are incredibly angry, and it goes back just to Douglas Ross, the Junior Scotland Office Minister, resigned this week, and he said in his letter, and I think this is crucial, that many of the public have made huge sacrifices, including not being able to hold the hand of loved ones when they're dying. And how could he possibly say to his constituents that they were wrong and Dominic Cummings was right? And I think that sums this issue up in a sentence.
Layla, can I ask you, as the sort of scientific voice on our panel here this evening, do you feel that compliance may have been undermined by the events of the last few days?
Well, it's interesting, isn't it? Because it's not exactly about what Dominic Cummings did or he didn't do. The question is really about what is the impact of that. And what we've heard from our members, who are CEOs of hospitals, of GPs, all across the health system, people are worried that public health messages are being undermined. They're already hearing that people are making decisions they might not have otherwise made, and that's really worrying, because in order for these for these public measures, whether lockdown, test, track and trace, any of these things to work, we need to have a really clear message that isn't open to too much interpretation and discretion. And we need to have this public feeling that we're all in it together. And I think that for those reasons, one of the hospital CEOs said to us recently that this could actually be one of the biggest risks to public health since lockdown began. So I think that all of these are key considerations as we think about what next.
Alison, can I come back to you? Has it had any impact on whether you will be more or less compliant as we're going into test, track and or test and protect or test and isolate now?
Well, no, from a personal level, I would follow the guidelines. I think I've got enough integrity to do that. But I do think that it will have an impact on some people who are just fed up with the whole idea that someone can get away with something when the rest are not supposed to.
Anyone on the panel instantly just think actually it really won't make that much of a difference, that people will still do what they feel they need to do in the current circumstances? I mean, this is a deeply unscientific poll, obviously. None of you are putting your hands up. Oh, yes, Eileen.
Hi, Fiona. I believe that it undermines the message, like Alison said, but had it been an MP, he wouldn't have got away with it. If it was anyone else, they wouldn't have got away with it. The fact that this person is so close and so influential to Boris Johnson, that's what rocks my confidence.
No, but what I'm asking you is whether or not you think it will make any difference in terms of compliance generally.
Yes, it will. Like Alison said, there are people with integrity out there. There's people who do the right thing for society, for their family. There's other people, like Dominic Cummings, looks for the loophole and looks for the cheap way. You're cheating society by doing this. Ultimately, you're putting lives at risk.
OK.
Behaviour breeds behaviour, especially with someone so influential.
Matthew, let's hear from you.
Just on that point there, Fiona, I think, you know, with all due respect, Ian, to what you've said there, I mean, if I'm not mistaken, Stephen Kinnock took it upon himself to go to his father's place to sing Happy Birthday. I mean, he did it quite blatantly as well, quite literally in front of the cameras. So I think this...
I mean, he said he was, in fairness, he said he was dropping off essential shopping for them that they couldn't get. That's what he said at the time.
Yes, but it wasn't done in an overly discreet fashion, you know, the filming of what happened there as such. And I don't have any political allegiance one way or another, but I think the public, from what I can sense anyway, people I know, are probably just a little bit fed up with the politicising of things as well. All we're after is just, if we are all in it together, like the slogan says, that indeed those people in public life, like it or loathe it, you have to adhere to that, probably to a greater extent than the general populace, because it comes with the territory, unfortunately.
Alex Massie.
Yes, I mean, look, I think at the beginning of this emergency, there were an awful lot of people all across the United Kingdom who, even if they hadn't necessarily voted for Boris Johnson or thought much of him previously, wished him well. They recognised that it was important the government had a grip on this crisis, rose to the challenge, rose to the occasion. And I think those sentiments were reinforced, obviously, when the Prime Minister fell ill himself. The events of the last week, I think, have enormously dented public confidence in the UK government's ability to handle this crisis, because people have seen and they have understood, and it's been based on their own experience and the difference between the way they've behaved and the way that, in this instance, Dominic Cummings has behaved. And they can tell the difference between these two things. Plenty of people, you know, you can sympathise with the predicament in which Dominic Cummings and his family find themselves, while recognising at the same time that many, many other people, hundreds of thousands, perhaps millions of people, have faced comparable situations, and they have obeyed the government advice, followed the government advice and stayed at home. And it's not unreasonable for them to expect people at the highest levels of government to do likewise. And, you know, I also do think that this scandal, because it has become a scandal, it started as a story, but the government's reaction to it has turned into a scandal, has fatally wounded a lot of the messaging that is out there at the moment. It is entirely understandable in some ways that people will take the message that if there is one rule for government advisors and a different rule for the general public, that they will take the view that they will do their own thing too, regardless of what the official advice says. And, you know, the government's arrogant dismissal of this, the suggestion that it isn't a story at all and that it's time to move on, won't do. I mean, you know, as my colleague Esther Webber said in the Times the other day, you know, the problem with the move on idea is that the general public isn't yet convinced that moving on is an essential journey.
Keith, you've got your hand up.
Yeah, I mean, I'm going to disappoint Alex here by saying, yeah, I think we should do exactly that, move on. I mean, for you political commentators and members of the opposition party, you know, the Dominic Cummings story must be like, you know, Christmas, your birthday, New Year, rolled into one. You must be loving it. I mean, Emily Maitlis has had to take the day off because of overexcitement. I mean, yeah, move on. I can't be bothered. I've got a mind of my mind of my own. You know, I know what to do and what not to do. What Dominic Cummings does or doesn't do has no impact on me at all. And, you know, I'm more interested in whether there's self-raising flour and eggs on the supermarket shelf tomorrow than listening to Dominic Cummings stories. So, Alex, yeah, let's move on.
Well, this will be music to your ears, Helen.
Well, yeah, and Keith's position is more what I'm beginning to hear coming through, that people feel that there's been a lot of talk about what Dominic Cummings did or didn't do, but actually what really matters is us having the pandemic under control and being able to get back to life that much nearer to normal.
What your constituents were saying to you when it first broke this story?
Well, of course, I've received emails from constituents, as every MP has, and Ian has done so. And I've received emails from constituents who, you know, talk about some of the sacrifices they've made and the things that they have missed out on. And I don't think we should suggest for a moment that lockdown is anything other than very hard. But that's why what's really important is that we now have the infection rate under control and falling, and that we're in a position to ease some of the lockdown measures and launching the NHS test and trace, as referred to by Alison, because that is so important to continuing to keep it under control.
And
so
are you worried
that
people may now... I mean, some people are obviously going to take the view from Keith there, you know, just move on and that it's over, I don't want to talk about it anymore, and I'm sure you won't be alone in that, Keith. I mean, others might be thinking, well, are there any loopholes here in this new system that we're all being asked in England and in Scotland to adopt from today in terms of test and protect or test and isolate? Because if there are any loopholes, and we obviously... It appears there were a few loopholes when it came to going all the way up to County Durham, when we all thought we might have to stay at home, in fact. If there are any loopholes, should we hear about them now, rather than perhaps find out later?
What we've seen so far is people really sort of consciously following the guidance, and in fact, you know, the guidance has included recognising that some situations will be more difficult. For instance, if you're looking after somebody who's particularly vulnerable, you have a childcare situation.
So just to be clear, if you have a childcare situation, then Helen, since you mentioned it, if you have a problem with childcare, and you happen to be one of the people who's identified as someone who has to stay at home for 2 weeks, you may not necessarily have to stay home.
Well, you clearly have to make sure that your child is safe, as any parent should do so. But for instance,
so if you have to leave home to do that, even if you've been told to self-isolate, you can do that.
Well, if you're contacted because you're a contact of somebody who's got symptoms and told to isolate at home, you should be able to do so with your child. Now, everyone will have had their scenarios, but I mean,
no. But just to be clear, because it's important, because we're all going to have to adjust to this now, this new system. So if you are told to self-isolate at home for 2 weeks, either because you have symptoms or you've been in close contact with someone who has symptoms, but you have problems with that, you find that difficult because of childcare issues, you can behave otherwise. You don't have to self-isolate at home.
You should follow the guidance, but I don't think anyone should suggest that you should have a child in an unsafe situation.
So follow the guidance unless you can't.
No, that's not what I'm saying, actually, at all. You should follow the guidance, and that's been the case all the way through. People should follow the guidance.
But what you're saying is... But you're saying unless...
But the guidance has always said that safety would be a factor, and you should be clearly a responsible parent. But I mean, I think what's really important is that people follow the guidance, and through doing that, that's how we manage to keep the infection rate under control, and so life can get back to normal or closer to normal, which would be so much better for everybody.
Fiona, can I say to Keith why
briefly, because I want to bring John
very
in.
briefly why Keith's partially right, but why we haven't moved on is because there's been no apology, no contrition, and the doubling down on saying that you can drive 60 miles to test your eyesight, and Michael Gove's touring television studios to say that's allowable because he was preparing to go back to work. It's treating the public like fools, and that's why people haven't moved on.
John Swinney.
I think the whole issue for me comes down to the point that when Dominic Cummings made this journey, everybody was told you've got to stay at home. And the reasons why you were able to leave home were really, really, really limited. And quite clearly, Dominic Cummings broke those rules to make the journey that he made. And Ian Murray's absolutely right. The ludicrous explanation that the thing you do when you're worried about your eyesight is drive your car for 60 miles is just beyond credibility. So the worry I have about all of this is that it has that effect that you talked about, Fiona, in the question, or that Alison talked about in her question, that it essentially undermines public confidence and public compliance. Now, we found this has been a really difficult pandemic for any government to handle. It's a challenge for us in the Scottish Government. But we saw polling information this week which demonstrated very, very high levels of public trust and confidence in the actions of the Scottish Government in how we have handled this crisis. Now, that doesn't mean there's not been hardship. It doesn't mean that there's not been suffering. But it means that we've communicated clearly. We've had tremendous consent from members of the public to the measures that we've had to regrettably put in place. And I worry that the Dominic Cummings fiasco and the arrogance that's been demonstrated by the Prime Minister and by Dominic Cummings and by all of the members of the Cabinet in the way that they've expected.
I mean, John, it's worth pointing out, John,
morning.
I'm sorry to interrupt, it's worth pointing out, isn't it, that when there was a similar issue in Scotland with the Chief Medical Officer who visited her second home, Caroline Calderwood, Nicola Sturgeon did let her go, but initially did try to hang on to her, as Boris Johnson is hanging on to Dominic Cummings.
Well, when the story about Catherine Calderwood broke, the first thing that Catherine Calderwood did was apologise. She accepted that she had made a mistake. And the First Minister said that Catherine Calderwood had an important contribution to make to the Scottish Government about the clinical advice that we required. But the First Minister accepted, as did Catherine Calderwood, that the very act of her not following the rules that she had set out undermined those rules.
Okay.
So she resigned within 24 hours. Now, that was so what was different here? Catherine Calderwood apologised. She accepted there was a potential damage to public consent and participation, and she resigned, and she did so with dignity. Dominic Cummings and Boris Johnson have behaved with arrogance and with disrespect to the public, and they have insulted so many members of the public who have suffered so many things, missed out on critical moments in the life journey of their loved ones, and that should be confronted.
OK. I think it'll keep Keith happy. We're going to move on from Dominic Cummings. Let's hear a question from Matthew. Matthew Den.
Thanks, Fiona. Track and trace appears to be encountering delay issues in the rolling out process, both north and south of the border. Why is it that other nations around the world have managed to expedite these processes? And could the Scottish and the UK governments look to adapt using their successes rather than too much reinventing of the wheel?
Are you referring to things like the app, for example, Matthew, that there are apps already being used in Germany and South Korea and other countries, for example, where we're still trying to get ours going? Is that what you mean?
Yeah, I think, most reasonable people would concede the Asian countries in particular, whether it was swine flu or SARS, etc., they're probably ahead of the curve because they've gone through pandemics previously, so they've been able to adapt technology. But there's plenty of other examples, dare I say Australia, for want of one, where they've been able to roll out this program of track and trace with great speed from effectively ground zero. And when the World Health Organization said at the start of the global pandemic, we need a joined up approach between nations, it almost feels like the UK government reminds me of my father when I was little, and you'd get lost and he'd never ask for directions because he had a superiority complex about it. And it just feels that way with the UK at the moment. Don't be afraid to ask for a bit of help rather than trying to go off in your own tangent.
Well, Helen, let's start with you. Let me just ask you about the app, actually, first of all. Where are we with this app?
So I know that the app will be brought forward in due course, but the system that we have got in place today is drawing on over 25,000 callers who will be implementing the
is the app just
system.
because we were told by Matthew Hancock that the app was incredibly important. And we don't have it. So is it just that it's not working? What's happening with it? Just update us.
So the app will support as we go further down the path. But the important thing is that we've got to a point that
yes, but I'm just trying to find out where we are with the app, because is it not working? Are there technical problems? Just fill us in.
I'm not personally working on the app, but we have the important thing is we have a system in place which we've been able to launch today, which means that it will support some of the easing of lockdown measures. And we have actually to pick up. I mean, we do look at overseas and what other countries are doing. We do absolutely look to make sure that we draw on the best of what you see elsewhere. And we have also got to a point, though, that we can launch the NHS test and trace system because we've now got the number of cases and the infection rate under control. So we're actually in a position that it will really work to do the contact tracing and the isolating.
And then because we're all getting to grips with quite how this is going to work. So if we develop symptoms, we contact one of these tracers. I'm not entirely sure who we contact, actually, but we contact somebody.
So if you develop symptoms, you should go home and isolate, and then you should order a test, which you can do online or by phoning 119.
So you inform 119 that you think you might have symptoms, and you ask for a test.
Yeah.
And then if you test positive, you are asked to then supply details of who you've been in contact with.
Correct.
But what do you do without the app? What do you do about all the people you've been in contact with when you don't know their name, their email address, their phone number? How's that going to work? So people you were on public transport with or in the shop with or a shopkeeper?
So this goes hand in hand with social distancing. So, for instance, that if you've been keeping a social distance and been 2 metres apart, that wouldn't count as a contact.
Sure, no, but for people where you have been closer, either in your workplace or perhaps because you've gone on public transport, without the app, how are you going to know who these people are for the people that we don't have the details
It's important when you're out and about that you're following the social distancing rules.
No, sure, but sometimes, as the government's accepted, it's not always going to be possible, particularly in a work environment. So when you don't necessarily know all the people you've been in closer than 2 metre contact with, without the app, how are you going to find them?
Well, I think you'll find a lot of people will know people that they've spent a sustained close period of time in close contact with. You would know about that, and that's what you will talk through with the contact tracers so that they can then contact them. And this is a system, this is a known way of dealing with a pandemic and controlling it. So we're not making this up as we go. This is a system that is known to work.
Are we ready, Layla?
Well, it sounds as though we're getting there with the human contact tracers as has been discussed. Clearly, it's only just launched. There are going to be operational issues as it starts to bed in.
Well, hang on, we were told it was going to be world-beating on Monday by the Prime Minister.
Well, I don't think that anyone in the NHS needs it to be world-beating so much as just really, really effective, and that's what we're hoping for. At the moment, it's just kicked off. We don't yet know what it's going to be like, but we are strongly hoping that this is going to be a really effective way of working. The app question is interesting because, of course, we were promised that the app would be here as part of that system. And in some ways, we don't need to be really distressed that it's not there on day one because it's only part of the system. It's not the main part of the system. It's an adjunct. It will be something that will improve our ability to find people who are at risk and make sure that they're able to quarantine and be safe. But I think that this is really more of a challenge that we keep on being promised that things are going to be here and then they're not. And it's part of what I was saying before about just eroding people's confidence. The NHS has had lots of disappointments where they've been promised PPE coming on a plane from Turkey and then it hasn't come, or they've been promised PPE that was going to work and then suddenly it's substandard in some way. There's lots of expectations that are raised and then they're dashed, and I think that what we're hearing from health leaders is promise things that you're able to deliver when you're able to deliver them, and that will really help to build staff confidence and help to build patient confidence.
Okay. Eleanor, you wanted to come in.
Yes, just picking up on that last point as well, there is a huge disconnect between what we hear on the daily briefings and the reality and the implementation of these policies on the ground, and having that confidence that the infrastructure can deliver what we're being promised. And it's really incomprehensible why the UK was so unprepared. I mean, countries like Turkey have been testing and tracking since the start with a relatively low death toll. And indeed, as you were saying in the panel, that we were told we'd get a world-beating system. But what's being rolled out now is only the basics of what we should have expected weeks ago. We're not testing asymptomatic cases. Tests are only available online, they should be available locally, I would have thought, and it just appears that once again the world has beaten us to it.
Sean?
I'm just wondering how useful this app will be. Dr. Hannah Fry said in 2017 in a BBC pandemic, and the biggest citizen experiment that she did of its kind for the next pandemic like this, most of the things that were coming out from that were about access to Wi-Fi, having the money to pay for Wi-Fi in your home, whether you have a phone that would be able to have this app and you'd be able to download it. My mum's over 70 and I don't know if she would be able to navigate something like that.
David?
Labour, I think you were too kind there on being very easy on the Conservatives with your comment, because the First Minister today in Scotland, she said that she was reticent to announce the move from lockdown that we're moving into up here in Scotland now. And I understand where she's coming from, because we've got to a point now where, for me personally, I've had an awful lot of trust in the First Minister. I may not be her biggest fan, but from her coming out at 12:30 every day and talking to us personally and giving us the brief she's given us, and then for the Westminster Parliament to do what's happened over the last few weeks, say what they've said and give that mistrust. I mean, there is huge mistrust. Nobody's going to tell me that, and I don't want to go back to Cummings into it, but the height of government, the power they've got, things they can do, that people can get things done. It's not like anything else that's ever happened. This pandemic is hitting us all. It's hitting us all hard. The trust is gone, and I don't understand how you can sit there, Helen, and turn around and say to us that we've got to get the pandemic in control. Well, to get the pandemic in control, you need the public on your side, and that's not what we've seen from the Westminster government. Ruth.
Hi, thank you, Fiona. My question is, this track and trace system, what happens if nobody volunteers themselves? Because my understanding it's a voluntary system. What happens if people don't give their name, for example? What happens in that situation? How is that going to be handled?
I mean, John Swinney, it's an interesting point, actually, because obviously if you do put yourself forward, if you suggest that you've got symptoms, you realise you're going to be in quarantine for the next 2 weeks, and also all the other people that you mentioned you've been in contact with, for a sustained period of time or close than 2 metres, you're effectively sort of dobbing them in, if you like, and they're going to have to self-isolate as well. So what to Ruth's point, because obviously you've got the same issue in Scotland as in England, what if people don't put themselves forward?
I think this is the link to the first question that we've just had. The reason why we've been successful in reducing the prevalence of coronavirus is because of massive volumes of public participation and compliance. And the same applies to the track, trace, isolate and support strategy, test and protect, that we're putting out in Scotland. It relies on people coming forward where they have symptoms, indicating that they have those symptoms, and then for us pursuing the contacts. And obviously there'll be privacy applied to essentially the source of the virus that's been drawn to the attention of other individuals. But it fundamentally relies on public participation, public trust and public confidence. And that's why I really appreciate the comments that David made about how the First Minister has communicated about the challenges that are inherent in handling a pandemic. And we need to have that similar level of communication and consent from members of the public in wrestling with the contact tracing strategy.
I mean, of course, it's a bit unfair to lay absolutely everything at Dominic Cummings' door. I'm no apologist, but nonetheless, there will be other factors that might influence whether people want to comply in terms of can they afford to take the time off work, that kind of thing. I mean, Alex, just coming to you, Matthew's question is, why is it that other nations have managed to do this faster? And could the Scottish and UK governments have learned anything from these and therefore done it faster ourselves?
Well, I think on the second part of that, the obvious answer has to be yes, and this is one of the many things that will be considered by the inevitable series of public inquiries that are going to follow the eventual conclusion of this emergency. One of the ironies here is that one of the fiercest critics of what you might term the dysfunction of the British state or the Whitehall apparatus and so on is one Dominic Cummings. He thinks that we need to fundamentally rethink, reimagine, reorganise the entire business of government. I happen to think that some of his diagnosis is quite persuasive. He is, of course, now in a position to do something about it and is discovering that curing something is rather more difficult than diagnosing it. I think that is something that is a long-term challenge for the British state. At the moment, in terms of how viable this contact tracing operation is going to be, an awful lot of that does depend on government communication, and that is one of the areas where I think we have seen Boris Johnson actually, fail, and demonstrably so, John, that he does not give the impression of being on top of his brief. He does not inspire public confidence, and that is a significant failing at a time and in a crisis where communication, clarity and consistency of communication are, if not half the job, then certainly a significant proportion of the Prime Minister's job or the First Minister's job or anybody in a leadership position at present.
OK, well, Helen, do you want to respond to that?
Well, actually, one thing I want to pick up is that the success of the next phase does rely on people absolutely being responsible and coming forwards and booking the test and then...
But I'm just in terms of what Alex was saying, in terms of Boris Johnson failing as a communicator.
I actually think he's an excellent communicator and also very effective at motivating the troops. And I do think, and I know that you can, of course, criticise any stage of the pandemic, if only this or if only that, but also that actually extraordinary things have happened. Extraordinary things have been achieved, a huge growth in the volume of testing at incredible pace, given
we have got the second
from.
highest death toll in the world. In absolute numbers.
Yeah. So I think we should we are absolutely looking at what other countries are doing. I think one thing we do know is that now is not the moment where we can actually really compare those kind of things between different countries. But the important thing is every life lost is somebody who we mourn and with sadness. But we also need to make sure that we are able to move on and keep the infection rate under control and try and begin to get life more in the direction of normal now.
Ian?
Well, I think, Fiona, one of the key features of this whole pandemic has been the lack of a coordinated international response. And I'm tempted to say at this point, could viewers in Scotland please turn over to BBC Two, because in the answer...
God, please don't.
We can't even...
if you don't mind.
We can't even get the four nations to work together. So the explanation that Helen gave at the very start of her answer to this question is different in Scotland. It's going to be different in Wales and different in Northern Ireland. And why we don't have coordination across the UK is one of the big questions that people keep asking. And let's not forget, and Layla's absolutely right, the reason we are so far behind in international terms with this track and trace is because we abandoned that as a principle back in early March and have only come round to realising that's the only way out of this. And the key elements of that, if I can just finish on this point, you have to test. This goes all the way back to what the World Health Organization said in January. England has a dreadful testing record, and you're going to have to do at least 250,000 a day to get anywhere near this being proper, and that's what we've been calling for. And Scotland has one of the worst testing rates in the entire world.
Okay,
and until that's resolved, this system cannot operate properly to keep people safe.
John Swinney, do you want to come back on that?
Well, we're now in a situation where Scotland has the capacity to do 15,000 tests on a daily basis.
Yes, but you're not doing anything like those numbers, though. Sorry, John, to interrupt, but you're not doing anything like those numbers, 15,000.
Well, but we've got capacity in place to now do that when it's at the most critical moment when we've suppressed the virus. And we have the capacity to do the contact tracing. We've got the communications in place to set that out. We've had that in place at the critical moment where we begin to relax some of the great restrictions that have been in place. So the strategy has come together in exactly the right timing to make sure that we have the capacity in place to provide the support that individuals in the country require.
And just to be clear, John, what's stopping you reaching the capacity? Sorry, John, just to be clear, what's stopping you reaching the capacity? So you've got capacity for 15,000 tests, for example, and you're doing nothing like those numbers.
Well, we're constantly expanding the range of individuals who are able to get tests. So, for example, we are doing a great deal more availability of testing within care homes. We have mobile testing services moving around the country. We have much more capacity available for people to go to get particular tests. We've got availability in place for key workers and for home care workers and for those delivering care services.
But Fiona,
so there's a whole range of different areas where we've expanded the capacity and the eligibility to make sure that individuals can get the tests that require it.
OK, Ian, very briefly, and then I want to bring
the epicentre of this pandemic is in our care homes in Scotland. Over half of all the deaths are now in care homes, and 46% of all deaths are in care homes in Scotland. We are still not testing care home patients. We're still not testing on a regular basis care home staff. And you can't talk about capacity. You have to talk about test delivery, and it's simply not happening.
Yes, we are. We're doing all that, Ian.
Not with the care homes that get in touch with me day and daily, whose patients, residents and staff are not being tested.
Alex, from the audience, you wanted to come in.
My question is, without the antibody or the fact that people know that they've already been infected, how is this track and trace going to work? I mean, am I going to be having to self-isolate over and over again? You know, if I come into contact with someone once, do I self-isolate, take 14 days off? And then I come into contact with someone else, do I then take another 14 days off? But people who are self-employed and other people are not going to be able to manage that. It's not going to be possible for people.
I mean, this is the tricky thing, isn't it? Because, as Alex is saying, you might have to self-isolate more than once. And let's just remind ourselves what that means. That means, for example, if you have to share a bathroom with your family, you have to use it at a different time from them. You have to wipe it all down. You have to, I think, put your rubbish in several bags when you put it out. I mean, and you have to keep away from your entire family. And you might have to do this several times.
We're not asking people to isolate within their households.
So you're not worried about if they infect their family?
So if you're being asked to, sorry, I should distinguish between if you're being asked to isolate if you've got symptoms, but this is the case
if you've just been contacted.
You're being asked to self-isolate at home with your house, but we're not asking everyone in the household to isolate. But it's during that period where you're in the possible incubation period to see whether you might contract the virus. And I recognise there's a risk that you might be asked to do that more than once. But if people follow social distancing, so if people are following social distancing and minimising their contact, so if they're having to go to a workplace to work, but social distancing in the workplace is really important because that's how you avoid becoming somebody who's a contact of the sort that needs to isolate.
Of course, we could, in England, you can go to barbecues now. I think in Scotland, correct me if I'm wrong, you can't.
You can from... Yes, you can.
You can go to a barbecue.
Tomorrow, yes, because you can 2 households, no more than 8 people. It's no more than 8 people. It's 6 in England.
6 in England.
2 households can meet socially distanced in public or private outdoor spaces. So you could have a barbecue. But this is how ridiculous this whole situation is. It's 8 in Scotland. It's 6 in England. Why can't we just get a UK-wide approach and everyone works together?
And also, a barbecue all keeping 2 metres distance. That's going to be quite. I mean, that's a heck of a garden you're going to have to accommodate that. I mean, and for no more than 15 minutes.
I mean, we're asking people to gradually. It's some small steps to try and make life be a little bit better.
Well, no, we're all just trying to make sense of exactly how it works, since we're all going to have to be doing this. OK, let's... Jeanette, you just wanted to come in. Let me bring you in.
I work from home and my girls go out into vulnerable houses. Now, this track and trace has the ability to close my business down every single week. And I don't know what I'm going to do. I'm already closed. Financially, it's been a nightmare. And now, if any of my staff or any of my families, or they go into any of the houses to clean or do anything, we're closed. And I was wondering, who's going to pick up the pieces for me? Because the small businesses who work from home have already been missed out on everything. And now we've got track and trace that could close me down again every single week, or have girls going off sick because they've been at vulnerable houses, vulnerable places, and they've been doing their job. And I just don't know what to do. How's the government going to sort this out?
Because you run a cleaning company, don't you, Jeanette? So you've got various people going out to clean other people's homes. So John Swinney, what is the compensation package going to be? I mean, so if you are someone, either you're Jeanette who runs a company, or you're someone who works for Jeanette, and obviously lots of small companies are going to be in a similar position, they suddenly get, either they get symptoms, or they're told, you've been close to someone who's got symptoms, you've got to self-isolate for the next 14 days and let's see what happens. What compensation will there be for them?
I think the point that Jeanette makes illustrates the fact that there has to be ongoing support arrangements in place for individuals and for businesses to make sure that people can navigate their way through what's going to be a difficult period if they have to participate in contact tracing.
So what will they be, John, very specifically? Because the provisions for the self-employed, for example, come to an end in about 3 days. And obviously the people working with Jeanette are self-employed. So what provision will be put in place for them?
That's really what I was coming on to, that there has to be a need for an ongoing scheme of support to assist individuals in that respect, which is why we continue to press the UK Treasury to recognise this is not a short-term issue, this is a long-term issue that we've got to see sustained. Now, the indications from the Treasury are that, for example, on the furlough scheme, that's going to be constrained in August by the Chancellor. And that's a very damaging move, because we know that the implications of COVID are going to be with us for a long time. So we're appealing to the UK government to recognise the longevity of this problem and put in place the support to enable that to be the case.
OK, well, we've got Helen Whately here, John, so let's ask her. So in someone in Jeanette's position very specifically, self-employed, that comes to an end in the next 3 days, what will the government do for people like her? So, I mean, I know, and on this I agree with John, and the importance of having the support for people who, for instance, are required to isolate because of test and trace. Well, it's up to the UK government, so what are you going to do? And I know that must be something that the Chancellor will specifically to look at is on the self-employment question. We know that for those who are employed, they will be eligible for statutory sick pay. Sure. If they are asked to isolate. But for someone in Jeanette's position specifically, she's come on the programme this evening saying, what are you going to do for people like me and who work for people like me? What is the government going to do? I can't preempt what the decision the Chancellor will make on that, but it's absolutely true that we do need to make sure that people are able to, afford what they need in life and recognise the costs of this. Also, that we do need to have, something which is economically sustainable. So we need to have a way to be beginning to restart the economy because of the huge amount of economic support that has gone to those who are in employment, those who that are in businesses, across the economy, a huge amount of support. We now need to get the economy back up and running. And more people going back to work. Well, I'm sure Jeanette will wait with great interest to see what comes out. As the Prime Minister said today, we will look after everybody locally who is affected by this. So let's see what happens. Let's hear now from Rena Cuthbertson. Rena.
Good evening, Fiona. Good evening, panel. Was a policy and decision regarding the emptying of hospital beds, with the patients not being tested, and the outrageous consequences on our elderly citizens, a planned arrangement, and if so, does this not highlight the lack of value and respect that we place in the elderly?
So was it a planned arrangement, allowing people back into care homes without being tested? And does it highlight the lack of value and respect? Yes. Alex Massie?
Well, the care homes situation, I think, is one of those areas where governments in all parts of the United Kingdom faced a terrible set of choices. That in hindsight, as Nicola Sturgeon said this week, they would probably make some decisions differently. At the time when people were released from hospital into care homes, it was because they feared that the NHS and the hospitals were going to be overwhelmed with COVID cases. And so, what do we do with people who are, delayed discharge, bed blocking, whatever? Well, get them out, almost regardless of their circumstance. And that now, because the sort of tsunami of COVID cases didn't quite materialise, that now looks to be a terrible mistake. And obviously, with hindsight, it was a mistake. But at the time it was made, I think it's reasonable for politicians to say, well, but this was the choice that we had available to us. But you can only do that, I think. You can only get the public to trust you if you communicate with candour, if you allow that mistakes will be made in a fiercely complicated and unprecedented set of situations. But you can't just allow that mistakes will be made. You have to actually sort of admit to them and take ownership of them as well. If you treat people like adults, there is a chance that they will understand the position you're coming from. But you can't just sort of deny that any mistakes took place. And it seems to me to be infantilizing the government of government ministers wherever they happen to be to try and pretend that that could be the case. People understand that this is a really, really difficult situation to manage, and that's why, even though patients may be beginning to wear thin, I think there is still a residual degree of goodwill for government if government can be shown to be responsive to the situation, can show that it is accepting and taking ownership of mistakes, and the care home situation is clearly one of them. But you can't go around prattling on about how you've thrown a protective ring around care homes at the same time as thousands and thousands of people are dying in care homes. And the final point of the question there, it is clear, I think, that for a long, long time, care homes have been a sort of overlooked, too often forgotten part of the whole health and social care network, and that sometimes perhaps seen as a convenient place to park people whose presence elsewhere might be deemed undesirable or too complicated.
Let's hear from Elaine in the audience. You've had your hand up for a short while now.
Hi, Fiona. I agree with Alex there. I think at the start of this pandemic, it was a tsunami and no one really knew what they were doing. And I think the choice, when we saw those horrific images from the Italian hospitals of patients lying out in corridors, couldn't catch a breath, I think the right decision was made at the time to make sure our hospitals were clear that we wouldn't have those images in the front of our newspapers. And I think Nicola Sturgeon has looked back, like Alex said there, and thought, in hindsight, it is a great thing and she probably would have did things differently. But I think the choice at the time with having that tsunami of patients, with COVID versus letting elderly patients go into a care home where we probably thought that was going to be a safer place for them at the time, was a lose-lose choice now that we look back. But at the time, to try and get away from those images of what we were seeing all over the press with people not getting a hospital bed, and we didn't. It didn't come to that, which is a good thing. So I think it is. It's a lose-lose. It's an unfortunate situation to look back and learn more of.
Rena, you wanted to come back in. You asked a question.
Yes, thanks very much. I think in terms of the planning, we have known about this since the end of December, at the beginning of January. I know it's not a long time, but what has been clear from the very start, the most vulnerable in the communities is the elderly. And we let people leave hospitals without being tested and put them into care homes. We put them back into their own homes to be cared for by home care workers or by support agencies or by family, and nobody was tested. And so I know there was tough decisions, and I'm not just talking about the Scottish Government, I mean generally right across the UK, and I know we were flooded with pictures of Italy, but maybe if the cameras were in and out the care homes, we would be flooded with as many pictures of people dying in care homes horrendously. I just think it's, there's no winners in this, and I know it's been difficult, and I know that, the whole thing's new to us. So I just think they're the most vulnerable, and they are always, I feel, the first to be forgotten. We clap and we applaud Captain Tom, and many of his generation have just been left to die in care homes, and I just think it's outrageous. And I think just the other thing, Fiona, to say is I've listened tonight, and every time the Conservative member speaks, all I hear is, well, we can't compare ourselves to other countries let's put the Dominic Raab to bed, let's not talk about anything that has shown us up to be, you know, the unorganised or, you know, party that they are.
Well, Helen, I'll give you a chance to respond to that in a minute. But, John, just coming in terms of... thank you, Rena, for that. I'm not trying to cut you off there. In terms of what Rena's saying, in terms of what Alex is saying as well, Nicola Sturgeon is saying, you know, with hindsight, which, of course, is a wonderful thing, I might have done things differently. When it comes to care homes, specifically asking you, what would you have done differently?
I think the circumstances that have been narrated by all three of the colleagues that have spoken, I can't really disagree with their analysis. At the time that COVID was coming towards us, we realised and we thought the best thing to do was to ensure that older people who were being accommodated in hospitals where there was no clinical need for them to be there would be better protected if they were in care homes, because if there was an influx of COVID cases into hospitals where vulnerable elderly people were, the danger of cross-infection was very high. So the judgment was if it was safe to do so, if the risk assessment was undertaken, those individuals could be accommodated either at home with support or in a care home. And there's been constant political pressure on us to reduce delayed discharges in hospitals, to get older people out of hospitals and into care home situations. So we followed that approach. But of course, we have discovered that just how brutal COVID is to older members of our society and our community. So,
but surely yes, we knew, John, sorry to interrupt, but surely we could see from the examples happening in other countries quite how brutal coronavirus was to the older generation. That evidence was already there.
Yes, but my point is that we judged that the best and safest way to support those individuals was in a care home setting or at home with support, rather than in a hospital setting, which would be the epicentre of handling coronavirus cases.
OK, well, let me just turn to Layla for a moment, because hearing what Alex Massie was saying, what John's saying, I mean, there were other countries before us grappling with this, and they admitted people from hospitals back into care homes. But in some cases, in some countries, they put them into quarantine, special places or quarantine within care homes. Is there anything we could have learned from that reasonably, or is Alex right that actually, you know, this was the best we could have done in the circumstances?
It's incredibly hard to say. I look at all what other countries have done, and as you say, there's been some sort of quarantine centres or interim places to go. It's not exactly clear. I mean, obviously, what has happened with COVID-19 in care homes has been an absolute tragedy. But the reasons for that are not quite as clear-cut as sometimes people are assuming. So we hear people say, oh, it's because everyone was sent out of hospital. But actually, when you look at the data, it's not totally clear that that was something that has created this challenge. And in fact...
Well, you think it might have spread in care homes anyway?
Well, that's the thing. I mean, at the end of the day, we don't know when this first started circulating. It looks as though when you started testing has a real impact on this, looking at other countries and care homes. It looks like people going in and out of care homes, potentially, of course, playing its role. And while we really, really want an answer to that, it's too early to figure out what's going on, but we can see that we need an answer and we need to learn. And I guess that what I'd say is that it really exposes the underinvestment and the undervaluing of social care for successive governments. And what we really need here is a bit of a long-term plan. We've seen what's going on in social care, and it's really great that the government is now giving some money towards social care to say, goodness, we need to bolster, for example, your infection control mechanisms. Our members have been telling us for ages that while hospitals have started to get PPE in, care homes have been in a much worse position for that. There's a lot of disparity here. So there's now funding so that care homes are able to get better infection control processes in place and things like that. But that's a short-term fix. And when we look at this, we think, goodness, the moment is here for social care reform. And what are we going to do about it? What's the government going to do about it?
Ian?
Well, I think the chronic underfunding of social care across the United Kingdom and in Scotland, the chickens are now coming home to roost.
And this is also a problem under a Labour government
It's been a problem for a long time, and we need some kind of political consensus to fund social care. We've been talking about this now for too long, but let's go through what we already knew. We knew that the prevalence of this disease was in older people. It was much more severe in older people. We knew from the 2014 report and Task Force for Social Care that there was 34 recommendations. Very few of them were implemented in Scotland. We knew in 2015 that the Scottish Government had said they would eradicate bed blocking. It wasn't done. We knew from the Silver Swan report there was a problem with PPE and a problem with testing if we had a global pandemic. All of that has since happened, and the decision was made by the Scottish Government to move 912 elderly people from hospital to care homes. Now, that in itself is a big decision, and it's a decision I completely agree with John. These big decisions have to be made. But the key thing here was that we're taking from hospital to care homes without testing. So we're essentially exporting the disease on the people that it affects the most into care homes.
We have just heard Layla say we can't be sure that that was the critical deciding factor in terms of the exponential growth of coronavirus in care homes.
46% of all coronavirus deaths in Scotland have been in our care homes. This is the epicentre of coronavirus, and that's why, because we sent people there without testing, we sent people there without the lack of PPE, and the figures are, Fiona, you looked at them earlier, Scotland does have one of the worst testing rates in the world, and the biggest problem with that is trying to get testing into the social care sector. We're only doing between 4,000 and 6,000 a day, so how can we possibly protect the residents and the staff in care homes without fundamentally testing them regularly and making sure that they are safe?
Helen, let me just bring you back to Rena's original question, which is, was the policy a planned arrangement, putting patients in care homes from hospitals who hadn't been tested, and does it highlight the lack of value and respect we place on elderly citizens?
So every step of the way, the government followed scientific guidance on what to do and clinical guidance. And
well, there was also, there was also government guidance. So on April the 2nd, the UK government guidance was negative tests are not required for asymptomatic elderly patients prior to transfers into care home. That was government advice.
But our government guidance was informed by the science and by the scientific guidance. But what has happened over time is, of course, that we have learnt. So, for instance, we've learnt and the world has learnt that actually we have a situation with people who may be asymptomatic carriers of the virus, and it's particularly hard, we now know, with older people who don't display the most common set of symptoms. So there's a particular reason, which is why we're now doing testing of all staff and all residents in care homes for older people, those with dementia, exactly to do that, to pick up those who may be asymptomatic as well as those who have symptoms, because we're learning. But I mean, just to go back and to pick up on some of the comments from the audience, and some really, really thoughtful comments. But one thing I will say is that I became the Care Minister on the 14th of February, and since then, I mean, so much of my time and so many people in government has been on how we can support social care, both care homes and home care, through the pandemic. And we know it's really hard. One of the things that we saw early on was looking at Spain and the situation where the army went into care homes where they'd been abandoned and people had just been left and left to die even from neglect. So we're put in place a whole new reporting system so we know what's going on in care homes, so we get a picture of where there might be risks of that. I should also say, and I know this, I talk so much to care homes, that we should recognise that in England, over 60% of care homes have not had a COVID outbreak. So actually lots of care homes have managed to do an amazing job in keeping COVID out of their care homes, and many of those who've had it have now recovered from that outbreaks, and things are getting better.
John Swinney, you wanted to come in after Ian. We were almost out of time, so briefly, I just want to let you have another word.
I think the point I wanted to make was that in Ian's last answer, he talked about the need for there to be measures to tackle delayed discharges, and then when the government tackles the issue of delayed discharge, we get criticised for it by Ian Murray. There are really difficult decisions that have had to be taken here with the best interests of the population at heart, tough decisions in tough circumstances. And many of the measures we've taken have supported care homes to make sure that individuals have had the resources and the equipment and the assistance in place to make sure they were kept safe in very difficult circumstances.
OK, I'm afraid, I know you want to come back in, but our hour is up. And I just want to say, Ellen, I can see you've got your hand up there and we've run out of time, so forgive me for not coming to you. Tonight, our questions came from Glasgow, and thank you so much to all of you. Next week, we will have an audience, a virtual audience from Southampton. And after that, from Cardiff. So from now on, we're going to be looking for 12 people to join our discussion in the way that we have tonight via video link. So if you'd like to be part of that, and I really hope that you will, and you come from either of those areas, do get in touch via the usual way, and then we will get back in touch with you. And of course, if you want to continue the discussion, you can join Adrian Charles and guests on Question Time Extra Time, and that is on 5 Live right now. But I just want to say thank you very much to the panel for coming into the studio tonight. And of course, thank you, John and Alex, for joining us down the line. And thank you very much to our guinea pigs this evening, the first time we've done this, joining us from Glasgow. I'm very grateful to all of you, and of course to you at home for watching. From Question Time, bye-bye.
We've got to be able to be more open and more able to talk about stuff.
Let it out. There's people out there that can help you. It feels really overwhelming.